I think I would like to explain, what we do in IVF. When a patient or a couple enters our protocol of IVF, what we do is we typically need 2 months. Usually all IVF cycles are preempted by a hysteroscopy. We like to go in with a telescope into the uterus and check whether the uterine cavity is normal or not. Depending on the protocol that we use, whether it's the antagonist protocol or the long protocol, we will start the injections. In the long protocol, usually the injections start 2 days before stopping the oral contraceptive pill, and these are continued throughout till we give her the trigger for ovulation. So typically it lasts for anything between 15 days to 21 days. Then once the oral contraceptive pills are stopped, the woman will get her periods. On day 2, she is supposed to inform us, and then she goes for a sonography. This can be done locally if the patient is out of town. On day 2, the sonography is informed to the doctor, and once everything is okay, there is no presence of cysts, we will start the stimulation. So usually the gonadotropin injection, which is usually an FSH or an HMG, is started on day 2 or day 3 of the cycle. And it goes on for about 8 to 10 days. So you have 2 sets of injections, one in the morning, which has been started before stopping the oral contraceptive pills, that is before the period, and the second injection is started on 3rd day of the period. Now starts the monitoring. Monitoring is done in 2 ways. We do a sonography. So the first sonography is done on day 2 of the cycle. Then second is done on day 6 or day 7 of the stimulation. So after the 6th or 7th day of injections, the sonography is repeated again. On that day, we also do a blood test to find out if the response is good. After day 7, every alternate day, the patient is called for sonography. Typically, by day 9 to day 11, she is ready for trigger. That means the eggs have reached their size of maturity. The trigger is given usually when the follicle size is typically between 16 and 20 mm. And once the trigger is given, the patient is asked to come to Leelavati Hospital or our other Bloom IVF clinic 36 hours later. So typically if the injection is taken on a Monday, Wednesday morning at 7 a.m. the patient gets admitted. On admission, she is of course nil by mouth. That means you have not had any water or food for since midnight. And then she gets admitted. Then after that, she's brought from the ward into the IVF operation theatre. Here a general anesthesia is given and a transvaginal pickup is done. That means we're using sonography and a needle, and suction is applied, and all the eggs are picked out of the body. This procedure takes about 10 to 15 minutes, so there's no stitch or no cut on the body. The woman then goes back to the room after 20 minutes and is discharged after 3 hours. Simultaneously, the husband is asked to give a semen sample. So this is how the whole procedure takes about 20 days from the day of the first injection. Now, once the eggs and the sperms are collected in the laboratory, the process of IVF begins in the laboratory. In IVF, what we do is we take 1 to 3 eggs in a dish, it's called a Petri dish, and we inseminate it with 1 lakh sperms, which are obviously motile and very, very fast forward moving, the best sperms. And then this is kept in the incubator. Fertilization is checked the next day, and after 48 hours to 72 hours, embryo transfer is done. Embryo transfer is again a very simple procedure. What we do is the patient comes in and 2 to 3 good embryos are selected, and depending on whether they need hatching or not, these embryos are selected in a dish. The patient is prepared. No anesthesia is used for this procedure, and the embryos are gently deposited using a transfer catheter into the uterus. It is all done under sonographic control, and the patient needs to keep her bladder full when she comes for the procedure. The procedure takes about 30 seconds. Usually the patient is kept on the table for 15 minutes after the procedure and then sent back home. Important point to remember is luteal support, that is, medications are needed after embryo transfer and they have to be taken properly. We give usually tablets and vaginal suppositories and of course injections every 4th day. So this is the protocol which is followed for every patient. For 14 days, she takes this support. And on day 14, after the embryo transfer, we do a blood test. The blood test, if it is positive, we will ask the patient to continue the support, and 4 days later repeat the blood test, because that is the only way we'll know that the baby is growing. Even if the test comes negative, the patient is asked to repeat a test after 2 days. If the second test is negative, then the patient is asked to stop all medications which have been given to her after the embryo transfer and report back when she gets a period, which typically comes in about 3 to 4 days after stopping the medications.